All right, cool. So let's get started. First of all, go ahead in the chat if you don't mind. Drop what year you are at UCCS and then also what your track is. So if you're pre-med, pre-dental, pre-vet, pre-PA, whatever track you're on, I would love for you all to kind of get a gauge of who's in the room. And yeah, I'll go ahead and get started. So I'm going to share my screen with you all. I might even ask for a volunteer if someone has something that they need to stop me to say for this presentation. I might not see your chat come up, so you can always unmute yourself and ask away. That's okay too. Okay, so this is about getting started. We're gonna just dive right into it. So these are just a few of the topics that we're going to cover and just a short little overview of this. And so we're going to talk about the timeline because it is very important to understand the timeline and the entire process of applying to professional school. We're going to talk about connecting with others, not just other students, but also your faculty members as well. We'll obviously be talking about the opportunities that you can get started on, that really you should get started on early. We're going to talk about why it's important to tell your story and kind of build on a theme, and that can all start early in the process. And then some early tips that I think would be the top things I would advise for getting started. So for when it comes to the timeline, it's really important because this comes to a shock sometimes if you haven't kind of done your research. But the application timeline itself can take sometimes 10 months to a year. Right now, because of COVID, everything is also really delayed. So some people aren't even getting to the interview stage until a few months before they would start medical school. And so that's a little bit daunting, but it's important to know that because if you want to apply and go directly into professional school right after you graduate, then you would be applying in your junior year. That's really important to know because some schools want you to have all of your prerequisites finished by the time you apply. A lot of schools will say, okay, you can have one or two classes that you haven't, finished yet, and you can apply, and with the assumption that you'll be finishing those classes before you matriculate. But it's really important to know this timeline. And that also goes for all, this isn't just for medical school, it's really any professional school path. They all have one cycle a year. They'll typically start between April and June. Medical school is going to start right at the very beginning of June. And so knowing that timeline is really, really important. Let me see. So why is that important? It's important for a few reasons. And some things to consider as well. Your grades really need to take priority. So if you are a person that isn't going to be able to juggle the demands of your prerequisite coursework and also all of the other extracurricular things that you're going to have to do, like your volunteering and clinical hours and all of that, then you really need to consider, what's your timeline going to look like? Because it might look a little different. Maybe you don't take a traditional 4-year path to finish your undergraduate degree. Maybe you want to take a gap year or 2 or 3, which is totally acceptable, and medical schools like to see it. And so we'll talk a little bit about that. And everything can take time. So that's something to think about too. So when you want to volunteer and you put in an application to volunteer at a hospital, it might take a few months before they get you into an orientation to start a volunteer position there. Getting a job, that can take months sometimes. So you have to really consider your timing, and it's always err on the side of starting early. I get a little bit more about a gap year. A lot of students, I feel like we have it in our minds, right? You finish middle school, you go to high school. You finish high school, you go to college. And so it just makes sense that in our minds, we're like, okay, I'm going to graduate and go right into professional school. But medical schools want you to be ready, right? And so the average age of matriculants into medical school is like 27 years old. That's for a reason. That's not only because there are a lot of reapplicants, But students need to get the experience, and that's what professional schools really like. They like to see that you took time off, you got a lot of experience, then you come back and you're really ready for your application. Your grades and everything that can be, all of that will still apply. During your application, you can go, you can take as many gap years, well, not as many as you want. I wouldn't go for like 20 gap years, but you can build on your experience, and even an MCAT score can last about 2 years, and so that's just something to consider. So what about right now? So let's say you're brand new, you're really excited, you want to go to professional school, it's something you've always wanted to do, or maybe you're later on in your years and you're realizing that is a path that you want to take. What can you do now? So the first thing I want to talk about is it's really important to start building on your relationships, not only with your peers in, finding study partners and people who understand the same process that you're maybe who are on the same track that you are and understand the process. It's also important to build relationships with your faculty members. This is a really, really important one because they're going to be your future letters of recommendation. And you have to have typically a minimum of 2 science professors and sometimes a non-science professor, who you'll have to have write you a letter of recommendation. And so it's really, really important to build rapport with them, go to their office hours, share your goals with them, this is your goal to go to professional school, and then keep in touch with that professor. They are, it's a good thing to ask. It makes them feel good that you ask them for a letter of recommendation. But you also don't want to like blindside them. If they have to, question who you are, what class you took, that's probably not a good sign, and you're not going to get a quality letter of recommendation. So starting early with that, and then when you find those faculty members that you really connect with, that you really like, those are the ones that you want to keep in touch with. And then, mentorship, we have, there's an organization, or it's like a software. I'm not really sure, but it's called the Mentor Collective. And that's where you can partner, and they basically connect you with a mentor, whether you're in your first or second year and you want to, a senior mentor, or maybe you want to become a mentor, which also looks great on an application. The Mentor Collective is a really cool thing. They're doing it out of the School of Public Affairs, I believe. I will drop that in the chat before we get out of this presentation to share with you all. It's also going to be on our website. Surprise! I told you I would say drop the website. Yeah, what else? Oh, yeah, student org. So obviously that's something you want to get involved on campus. That's going to help you connect with your peers. Again, the Pre-Health Society is a great one. I'm really engaged with them, and they're really, really awesome. They have really good presenters. They have sometimes professional school admission board members who will come and present. So that's really, really valuable information. And the Global Medical Brigades, they're going overseas and doing some really cool trips. But something to consider is do what you enjoy, do what you really like. If you can build on like a hobby or a skill set or something that you really like to do, not only is that going to help you in like your self-care, but it's also looks great on an application, and you can talk about that. If you play piano, don't stop playing piano because you're overwhelmed with, your medical school application process. You could tutor piano. That's a leadership quality. You can join some kind of a musical group or club and get involved. So always consider hanging on to some of those hobbies that you really enjoy, and you can always bring those up too in a medical school interview. So how to get your experience. So why this is important is because when you are applying for professional school, you will have an opportunity typically to write about 15 different experiences. Those are going to come in the form of shadowing experience, volunteering or community service, research experience, job experience, clinical experience, international experience. So you're going to have some about 15 places that you can talk about those different experiences on your application. And so starting those early is great. And shadowing is one that if you can start doing that early, the earlier the better, and the more the better, and the more diverse the better as well. So, what is shadowing? Shadowing is simply observing. So, you get connected with a medical professional. Ideally, it's someone who's in the field that you want to work in. So, if you are going to want to go to dental school, you're going to shadow a dentist. If you want to go to an allopathic medical school, you're going to shadow an MD. If you want to go to an osteopathic medical school, you're going to shadow a DO. So, those correlations matter. But obviously, really anyone who's in that same sphere, even like nursing professionals, you can shadow as well. But it's going to give you an idea of what their day to day looks like. And you are quite simply just observing them, watching, taking notes, definitely taking notes on the entire, everything that you learn. And then it's really important to kind of have that social awareness of when to ask questions and when not to ask questions. So you're invited to shadow. That doesn't mean that you're interrupting them every 5 minutes to ask a question. So that's something to kind of consider when you're thinking about shadowing. And so when you're shadowing, you are not engaging with a patient. And that's the difference between shadowing and clinical hours. Clinical hours is direct patient contact. It's required for admissions because they really want to know that you have a good sense of what it means to be a practicing professional, doctor, dentist, PA, veterinarian, whatever it may be. It's also a really good way for you to explore a career in this area. So even if you're not dead set, if on professional school, you're not really sure, you're on the fence maybe, shadowing can give you some of the answers of what that profession will look like in the future. Um, the question I'm sure a lot of you are asking is how do you get shadowing experience? And it's going to come down to networking, asking your family, friends. Think about your own primary care provider. Do your family members know any medical professionals? Do your friends have family members who are medical professionals? You just have to start reaching out in that way, putting yourself out there, which sometimes can be awkward, but it's for a good reason. And a lot of professionals really want to engage with students. Unfortunately, because of COVID, it's been a little bit more difficult for professionals to say yes because they want as few bodies as possible in their clinical settings, which is totally understandable. One approach that you can do rather than just shooting out emails asking, because it's really easy to say no to those emails. One thing you can do is, well, you can show up in person, which I don't know if I'd recommend that right now, but you can ask for informational interview. So, an informational interview is as simple as, hey, I'm really interested in your profession. I'm a student at UCCS. I want to go to veterinary school, dental school, whatever it may be. And I would love to just ask you some questions about your role and your professional, in your professional role and how you got there. They're a lot more likely to say yes to like an informational interview, whether that's Teams or Zoom or on the phone. And sometimes you can start to kind of build rapport with them in an informational interview. And then maybe at the end of that, you kind of finish it off with, I would love an opportunity to shadow you in person. And then you are much more likely to get a yes than a no or be ignored, right? There's also virtual shadowing. I get this question a lot. Virtual shadowing, sure, it's great. It's definitely not the same thing. I definitely advise you to never pay for virtual shadowing. There are plenty of free opportunities that you can find and actually we'll have listed on our website. And I have a shadowing guide too, which if I've met you before, you probably have it. So definitely don't ever pay for virtual shadowing. But it is an option. And just to note too, like a lot of medical schools and professional schools, they know how difficult it's been to get shadowing hours. Pre-COVID, it was probably 50 to 100 shadowing hours was pretty sufficient. But now, they're being a lot more lenient on the shadowing. Like they're not going to throw your application out if you don't have a ton of shadowing hours. So I wouldn't get too hung up on it, but it is just such a helpful thing for you personally in your journey to become a professional in the field, to really know and understand as much as you can about it. So that's a little bit about shadowing. And, definitely don't put yourself in a box. Like maybe you know for sure that you want to be a neurosurgeon, so you have to shadow a neurosurgeon, which I totally get that. But there are so many other, opportunities in the healthcare field that you can find, that you can reach out to. So definitely think about the diversity of your experiences, whether it's shadowing, volunteering. Those are the areas that you can really think outside the box, and shadowing in, an urban area, and also shadow in a rural clinic. That's a great opportunity, to also showcase that you've kind of seen maybe some differences there and can express that on your application. So moving right along. So then volunteering. So volunteering is great, and it's a great way to get your foot in the door and get started. And you can volunteer in so many different ways. But it's really important to do something that you're passionate about, not something that you're doing just to check a box. It's also really important to do things, to do a volunteering experience over a long period of time versus like a 4-month volunteering role, and that check that box and you're done with that. So they can spot that from a mile away. It's really important to have that consistency. It's going to show that you care, that you're dedicated. You're going into this field because you want to help people, but you really need to show that instead of just saying that. A great way to show that is with sometimes really long-term volunteer opportunities. The cool thing about volunteering is you can be really flexible with your hours. Like you can let them know, these are the times I can volunteer. And healthcare, especially hospitals, they need volunteers. That helps them. I'm constantly getting calls as well from hospice care, nursing homes. They need volunteers badly, and entry level employment opportunities as well. That's a great way to get a ton of clinical hours fast. If that's something that you're thinking about or in that realm, then hospice care and nursing homes are definitely in need. Um, but yeah, so clinical hours, like I said, so that's direct patient contact. Sometimes, you'll sign in to do volunteering with a hospital, and they're going to have you pushing papers, they're going to have you changing bedding, they're going to have you doing nothing related to what you really want to do. But it's important to stick with it. Okay. It's important to stick with it because once you get your foot in the door, you're going to have opportunities to network. You're going to have opportunities to speak with the staff, speak with the nursing staff, and start to kind of build some relationships that could eventually lead to some great shadowing opportunities. And eventually you can advocate for yourself and say, hey, I really want to start taking blood pressure. I really want to start getting some clinical hours or direct patient contact and exposure to different things in that healthcare area. So stick with it. It's also cool over a really long period of time, think like 2 years, where maybe you only are volunteering like 4 hours a week or something like that. Totally acceptable. And that's something that they like to see. So definitely think about volunteering. It can lead to really impactful experiences, which you'll be speaking about in your application. And we already talked about that a little bit. Oh, as well, yes. So how do you get volunteer opportunities, right? You have to reach out. Google's your friend. Google's my friend. Google's all of our friend. But I also have on our website a whole kind of beginners list that takes you directly to their volunteer web pages. So typically with hospitals, like UC Health has a very long process for getting volunteers in the door. You have to fill out an application. You have to do a background check. They make sure that you're vaccinated and everything. You have to go through an orientation. So it's a process to get volunteering in some of the big healthcare centers here in like Colorado Springs, like UC Health and Centura. I'm sure some of you probably have experience and have already gotten volunteer hours. So maybe we can talk about that when we do our little Q&A after this. So another kind of form of volunteering is community service. Another opportunity to do something that you really care about. It doesn't have to be in healthcare. We already kind of made that clear, I think, but showing that you really want to help people. How have you helped people? What has impacted you in that sense? So I know a lot of students tutoring is a great one. You can get involved at UCCS. They have the Excel centers, the Excel Writing Center, the Excel Science Center. If you're great at science, you can go and sign up to be a tutor in the Science Center. That's a great leadership role. That's a great kind of volunteering role. Volunteering in schools. I recently met with a student who is going to sign on to be a volunteer firefighter. Really cool, and can probably come with some great stories to tell that will really be impactful. Um, so we already talked a little bit about over a long period of time looks better. You gain clinical. Yeah, let me make sure I covered all of this. Yeah, also you can be innovative, right? So think about leadership opportunities. What doesn't exist that you wish did? Start something, create something. That always looks great. That's a leadership, that's really taking the initiative and being bold sometimes. And risking a little, a little bit, and that looks good on an application. Shows a lot of leadership qualities, especially if you start a club, start an organization, start your own, uh, you know, I don't know. What did I just met with a student. I think I already mentioned this. She teaches piano. So she started teaching piano and kind of made her own little side hustle. But that looks great on an application too. So something to consider. So then I kind of finishing out, which we're doing great on time. So some of the top tips that I would give for getting started. One is start making your list of programs tonight. Make your list of programs that you want to apply to, that you're starting to, maybe you've never even thought about where you want to apply. Maybe you've only thought about like Anschutz, but when it comes to your application, the more places that you apply to, the better your chances are. And so you need to start formulating your list. Um, we have plenty of on our website. You can go and find the specific professional programs that are across the nation. Usually, the professional associations will also have those on their websites. But making that list is really important for a few reasons. One is because sometimes the requirements are a little bit different. Some places maybe really value shadowing experience. So you're going to need to think, ooh, I probably need a lot of shadowing experience for this program. Others maybe don't even mention it or say, don't worry about it. Don't worry about shadowing. Because of COVID, we're being really lenient. Some programs say you need to have your prerequisites done by the time you apply, which if you want to, go into professional school right after you graduate, that's in your junior year. That means taking, sometimes taking biochem before your junior year, which is kind of unheard of. But also if you're not ready for that, then you need to start considering like, okay, I need to apply to programs that will allow me to take prerequisites even after the application cycle. But basically, moral of the story, make your list. I'd also advise you to maybe create an Excel file where you're kind of jotting down requirements and what's different with different programs. Because 9 times out of 10, the questions that I get asked, I have to say it depends on the program, and it really does. Everyone's different. I wish it was just like a universal truth for all of for all the application requirements, but it's just not. So then the timeline, understanding the timeline, thinking about, if you haven't already thought about it, but thinking about what a gap year might look like. It might really be great for you, especially if you're overwhelmed with classes, you're trying to, keep up with your GPA, and you just don't think you can do volunteering or shadowing or get employment right now. Start to think about a gap year or two. It's really, really a great idea if you need that time to focus on your studies. Connecting with your peers, we already talked about that. Think about letters of recommendation when you're engaging with your faculty members, and then telling your story. So, what is your why? So, you think about when you were little. What was the first, kind of thought that came into your head? What was your first engagement with healthcare? When did you first get the idea that this was definitely the path that you wanted to take? You need to know how to tell that story. You really need to start thinking about the experiences that you're going to go out and try to get and how that can weave into your story. And then I think one of the most uh, important tips I would have is to start journaling those experiences. If you haven't already, start a backlog, start journaling, start writing about all of the experiences that you're having. You're going to include the date. You're going to include how many hours it was, how many clinical hours, like how much time were you directly with patients? How did it make you feel? Who was there? What was the environment? Get detailed, because when it comes time to apply, you're going to have all that information already written out, and you will be so thankful that you did that. Oh, also, I had a student recently who talked about an app that she uses to kind of track all of those experiences. I think it was Mapped, MAPPD, but I think you have to pay for it. Maybe someone has some tips on that, but definitely some kind of way that you can journal these experiences will be helpful. So self-care, I know this is probably like overused term, but it really is important. And when it comes to, applying to medical school, do you want to be the best applicant you can be. You want to be the best professional you can be. And a lot of that means taking care of yourself. And so that's, keeping a healthy routine, knowing how to manage your time, utilizing resources like our tutoring centers, utilizing office hours, meeting with your academic advisor if you're confused about courses or coursework. All of that really does matter. Then, like I mentioned before, if you're feeling really overwhelmed and burned out, think about a gap year. It's a good thing. Gap years are good. I can only say good things about a gap year and how it could really help you just build on your application to make it better. Journaling and reflection, not only is that really important, like I just mentioned, but it just also can be therapeutic. So definitely start. And then also, it kind of trains you in reflective writing a little bit, which you'll need for your application. You'll need to kind of be good at that process. So if you're not already, start journaling. Doing what you love outside of healthcare. Obviously, you're going to love healthcare because you want to go into this profession. So I totally understand. And it's totally okay if that's all that you have on your application, but you can stand out in a special way if you have other hobbies, other interests that you can speak to, about who you are. And medical schools want to know who you are, even beyond, the clinical hours and the patient care. So, and then yes, your peers. You're not alone in this process. It can seem extremely overwhelming and sometimes just so daunting, and like you're the only one who's doing this, but you're not. So getting to know each other, the pre-health society, all the student orgs are great for that, for making those connections, and networking with your peers can also lead to some great opportunities too. I'll be having a focus group session, and that's going to be March 31st. That's going to be a great time if you want to meet people, engage, and start like throwing ideas out there. If you have questions, hopefully people in there might have some answers, and you can share experiences in the group session coming up. And then I'm a great support for you all. If I'm sure some of you have met with me before, but I help with an array of different things. And, when it comes to getting employment, I can help with a resume and cover letters. I'm setting up these info sessions and these group sessions. They'll be coming out every semester at the beginning of every semester. And so you'll have opportunities to join others if you haven't been able to come to the ones so far. But these are the upcoming. So I didn't talk about entry level healthcare jobs and employment, but that's something I'm going to be talking about on March 9th. And then, yeah, like I just said, the focus group will be on March 31st. I also meet with alumni. So that's kind of a big surprise to some students. But, if you wanted to take a gap year or a few gap years, I can meet you when it is time to apply, and help out. This is our new space. It's a picture of our new office. You've got to come in there. It's really cool. It's state of the art stuff. There's great couches. You can come study. We have Clyde's Closet if you ever need like professional clothing for like an interview or for shadowing or whatever it may be. You can come into Clyde's Closet and pick out like up to 6 clothing items. Like if you like thrifting, like I love thrifting, it's kind of like that, like low level professional attire thrift store in the career center, which is pretty cool. Yeah, and so this is some contact information. So I'm just going to point your attention to this website. So career.uccs.edu. What you'll do when you go is go to the tab at the top that says industry, and then you'll get a drop down menu and go to pre-health healthcare, and you're going to get some great information, some great resources. Everything I've just mentioned and said, go to our website. It's there. And hopefully it can also help you kind of organize all of the things you need to do, which I know it seems like a lot, and it is a lot, but it's all in one place. And yeah, so that's kind of what I have. I wanted to save some time, which is good. We have some time for questions. So, oh yeah, all of you mentioned in the chat, sophomore, oh, we got some juniors, great, pre-pharmacy, pre-PA, pre-dental, awesome. Oh, yes, sorry. Let me link the website real quick. Did I stop sharing my screen? Yes, I did. Didn't I? Okay. Well, you can put a question in the chat or just talk to me if you want to. I would love to help answer any questions, or we can just talk. So UCCS does not have I think what you mean is a post-bac. So a post-bac program is essentially taking some of those prereq courses again. And UCCS does not offer a post-bac program. And here's the tricky thing with that. If you graduate, you really want to retake some classes or get into a post-bac program, it doesn't look good for you on an application if you start it at UCCS. So UCCS doesn't have an official post-bac program. Can you come back to UCCS, declare a major again, and start taking those classes? Yes, but on your application, it's going to look a lot better if you go somewhere like University of Denver, Boulder. There are a ton of post-bac programs that you can look into across the country. It's going to look better to take a post-bac program in a different university. For one, it's going to show like, oh, okay, they can do it in another setting. They can do it with different, sometimes a different teaching or learning approach. And that is something to consider if you're thinking about a post-bac program, but UCCS does not have like a set post-bac program. So international students, and this is tricky. It's hard because if you're on like a visa and you want to get work experience, it's going to be hard to get hired for a lot of reasons. There's a lot of barriers in place for employers and for international students, unfortunately. You can always reach out. I know that typically with volunteer opportunities, they give you that option to signify that you are an international student. So let me find our website link. I'm going to send you here and have you go to, there's a community resources tab. That's our website. I just posted it in the chat. It takes you straight to the pre-health healthcare. But you're going to need to just go to the locations that you're interested in interning. So an internship, you're not getting paid. So essentially, I don't see why you wouldn't be able to, but it'll depend on the location and the program that you're interested in. So grade forgiveness, I know that grade forgiveness started in fall 2021, so anything prior to that will not count. I do have information on that. Get that for you. The best thing that you'll be able, you really want to talk to your academic advisor when it comes to grade forgiveness before you start signing up for classes. But this is the website on the UCCS grade forgiveness policy, which is pretty new. It's just started actually. So I would definitely look into that and then talk to your academic advisor about coursework and grade forgiveness. Cool. Oh, can you guys see my messages in the chat? Oh, wait, this is just to, sorry. I was just sending links to the specific person, to Victoria. So Victoria has all the links. Sorry about that. Here's the website. And then here is the link for grade forgiveness. Yeah, and it's kind of a harsh reality that when you're applying to professional school, you just have to have stellar grades or you just won't be competitive. And I hate that for all of you. They do look at students holistically, but at the end of the day, that threshold, that GPA threshold is probably the most important component. For medical school, it's going to be your GPA and your MCAT. PA programs, they have you taking the GRE, but that even isn't, that's maybe 30% of schools are wanting the GRE scores. So your GPA, your science GPA specifically, it's weighed so heavily in the decision process. And so it's really important to keep your grades at the peak that they can be. And sometimes that means, kind of resituating your timeline and thinking about the gap year, like we mentioned. You can spread classes out that way sometimes if you wanted to do longer than just a traditional 4-year path, just so you're not so overwhelmed with OChem. I know specifically. Yeah, GRE, it's interesting because a lot of professional school prerequisites are going into a lot of really upper level coursework. And so a lot of times I'll hear about PA students who take the GRE and they're like, it was so basic. So think back to like your entry level bios and chemistries and, think about kind of the baseline of information that you build on as you go up in your coursework. And the GRE, it's here, let me send you some information on the GRE. The good news is you can honestly totally avoid the GRE sometimes because it depends on the programs that you're applying to, but a lot of schools are not even requiring the GRE. So Kaplan has some pretty good information. So here's the GRE information. But yeah, from what I've heard about the GRE, sometimes it's surprising that it's a little bit more basic information, testing on more basic information than some of the upper level, whereas like the MCAT really dives into a lot of upper level sciences like cell bio and microbio, which will not be on the GRE. I was looking, yeah. So, okay, good. Yeah. So I have a link on our website, the site that I just posted for the Mentor Collective, which is how to connect with a mentor or become a mentor. And those are great. The recording of the medical school application process is also posted on that quick link, so the very top of that page. And then you can go down to your specific track and just learn more. You can buy plenty of review books, or you can even you can sometimes pay for like classes that can help give you kind of an overview. You can also check with the UCCS library. So the UCCS library is going to have a lot of free resources. They might be like a year or two old, but I would definitely check out the UCCS library for not only the GRE materials, but also the DAT or the MCAT. They're going to have some free resources. My husband's downstairs yelling at something. I don't know what's going on. Well, does anybody have any other questions? Did you get were you hoping this was the information, or did you get the right information in this session? I hope so. I hope it's just kind of a starting point. Please shoot away, ask questions in the chat. I'm here till 6. But yeah, if you also want to make an appointment with me, I can help. Sometimes that specialized, information can help with getting you on a timeline or figuring out what you need specifically. And so I'm happy to help. So shadowing hours and clinical hours. So shadowing hours, you are only observing. So you're like a fly on the wall. You're not saying anything. You're watching what's going down. You're taking notes. You're quiet. You're not interacting with patients. Unless someone directly asks you something, you're really just there to watch and learn. And then clinical hours is where you have direct patient contact. So whether that's in a volunteering role, and you are able to volunteer and you're working with patients, or you are in employment. So typically a lot of students will become a CNA, which is a certified nursing assistant, or an EMT, or a medical assistant, or a phlebotomist, or whatever that looks like. And then they're getting that direct patient contact. So direct patient contact, especially important for PA. They're going to be wanting upwards of 1,000, more than 1,500 clinical hours before you apply. And so if you're really interested in that, I would really urge you to come to the other information session where I'm going to be talking about that employment, because sometimes those entry-level roles you have to get certifications in, but that's probably the number one way to get the clinical hours and exposure, but you can also do that with volunteer roles as well. Yeah, let me get my link and to make an appointment with me. It's through Starfish. So let me get that for you real quick. Or it's on our website too. You can just click on make an appointment on our website, but let me get that. I think this will work. So here's the link to my Starfish. Oh, no, it didn't work. Okay, well, basically, if you go to the website, you'll see my picture on the right side, and there'll be a little button that says book an appointment. And that's where you can make an appointment with me, or you can reach out to me through email, and I'll put my email address in the chat as well. Any questions or thoughts? Oh, I'm going to stop recording. Huh, this has been recording the whole time.